Good evening everyone. Today we are going to discuss placental calcification. Placental calcification, it is the deposition of calcium and phosphate minerals in the placental tissue, and it is most common on the basal plate. Calcification increases with the advancing gestation, and greater degrees are associated with smoking and increasing maternal serum calcium levels. Placental calcification is diagnosed non-invasively by ultrasonographic examination and identification of echogenic foci. It is classified by Greenham grading. According to this, it is divided into 4 grades. Grade 0 means the placenta is homogeneous, it lacks calcification and displays a smooth and flat chorionic plate. Grade 1 means placenta has scattered echogenicities and subtle chorionic plate indulations are visible. Grade 2 means placenta shows echogenic stippling at the basal plate and large echogenic coma shapes originates from an indented chorionic plate, but the curve falls short of basal plate. And grade 3, which is last, it shows placenta has got echogenic indentations which are extending from the chorionic plate and reaching to the basal plate, which create discrete components that resemble cotyledons, and prompt expedited delivery is needed, and it is associated with higher risk of adverse pregnancy outcomes. As conclusion, as a predictor, this grading scale, it is not useful for the neonatal outcome near term. Now we will look for these findings which you have just read now in the subsequent images. So in this image, grade 0, smooth chorionic plate is visible and no echogenic densities are seen within the placental substance. Whereas in grade 1, subtle indentations of chorionic plate are visible. Second, that is echogenic areas are randomly dispersed in the placental substance. Then grade 2 means coma-like densities are visible on the chorionic plate and basal echogenic densities are seen on the basal plate. And grade 3 means indentations of chorionic plate are seen and irregular densities with accosting shadow.